I'll be talking about telerounding surgery and uh, and also about what I have been doing uh, 22 years, that is about infrared imaging. And today I will present a new concept that how it's possible to use robots in post-operative, not only on, as much of you knows, robots during surgery, but in post-operative. So I will start sharing my screen, and I will show maybe I show a presentation that was when they launched this robot in China from Xiaomi. And when they presented this for the first time, most people became impressed in how will be our future in many fields and also in medicine when we have robots that give support and talk with us and that can communicate with us. So from that time, we are being studying robot assisted medical thermography or infrared imaging concept and applying this in our medical field. And I will show you that this is something very important for us. We cannot be blind for that because we must understand we can be better in what we're doing actually and also in our communication with the patient. So this is our team, and we accumulated many years of experience in surgery, engineering, and also infrared imaging. And now I will present concept to you. And we are often worried when we are told and when someone in our family receives the surprise news that they will undergo a surgical procedure. So is it possible to make the post-operative period a more pleasant and safe experience for both the patient and hospital? And it's strange to ask that because it's not. Maybe could be better because when you go to a surgery, most of the time the residents or the uh, surgeon, surgeon, they only pass once a day to talk with you in some 5 or 10 minutes or less than that. And in this a very short period, they analyze many different things. So the communication is not so broad there at all. And the clinical to find problems most of time is not so accurate in so fast time. So is it possible to use technologies that increase the patient participation in the postoperative period without losing focus on their recovery? This is another point, ethical point, is that most of time in post-surgery, we don't give opportunity or for the patient to choose what is they must do, or not means that patients are guy surgery, but the the participation of the him in what is happening with him, especially when we have a complication or a suspicion of something is not going in the right way. So if you pass once a day, less than 5 minutes, how do you discuss this with your patient in these moments, in these critical moments that are not so common, but can help? So can hospitals provide better post-operative care with new preventive, interactive, and intelligence technology? Can a hospital provide better this with the technology? Sure, we can do that, especially in communication. Communication is a point of emphasis for all medical providers. Traditionally, the doctor-patient relationship has mainly been determined by face-to-face contact. With this bedside interaction, patients would be satisfied with their medical care. So it's very important, doctor-patient relationship. Uh, but effective communication with patient is critical and has improved patient compliance and facilitates better patient understanding of health needs and management during their post-operative. There is a continued focus on improving communication between patients as a means of improving patient care. And robots and new technology could be improve that, and not as much people think that, oh, you disconnect or you're more, there less contact. No, I improve this on this presentation. A diagnosis goes far beyond the verbal communication. It's not just an anamnesis or what the patient talking, but how he's talking, his face and what he's feeling, the movements and the eyes and the mouth and blood and the face. The human body produces many biological signals that can be crucial in early diagnosis. The voice and the kind of voice and many other things, and that are often subliminal in communication. We are limited to 5 senses: feeling, breathing, heartbeats, sweat, human body heat, and other electromagnetic impulses beyond the visible, and infrared, and combination of them, all of them added, can bring a new perspective to post-operative evaluation for a new generation of surgeons. So imagine you can see beyond the visible. Imagine you can see the blood flow in a hypermetabolic situation, or in a stress mental situation, or in a fear, or also an infection of the wound. This is also possible, actually. Given the scheduling demands for surgeons, both in the office and operating room, a time-efficient and effective method for communication with patient is crucial. So how much time we need to have a good communication with our patient? How much time? It's impossible to stay more than a day or 1 or 2 hours to talk with the patient and during post-operative. Fortunately, time constraints inherent to a busy surgery practice to often lead to poor communication between the physician and the patient. And let's remember COVID-19 pandemic has changed the manner in which clinicians interact with patients. Personal protective equipment, social distancing, and triage. It brings new ideas how to increment this, and how we could be more effective on this communication. In 2020, we have introduced, our team introduced the fever and non-fever screening of patients suspicious of COVID respiratory infection. With this sensor, it's infrared camera that uses artificial intelligence, and we presented and published this in 2001 in Nature, and it was international research that we did in US, Brazil, Mexico, Lebanon, and Netherlands, and where we increased the feeling of the region, identifying suspicious changes on the face with high sensitivity, and most of these cases were confirmed as COVID. And with this technology that you started to use during surgery, detecting perfusion of the heart without touching, without contrast, and with AI detection, we map the circulation on real time with this kind of sensors, and should create infrared post-operative service automation for health based on previous experience of COVID and heart surgery. We had to join 3 concepts in one. We joined remote service, telepresence, face-to-face service for screening, and telerounding, post-operative robotic support. So we construct all in one platform for all these solutions together. And this is the solution, our robot-assisted medical infrared image. On that time, without hands or limbs, but no problem. It works very effectively. And here he is trying to do. On that time, we did some training for him to conduct the exam by itself, totally automated, give instructions for the patient to identify, to be positioned in different situations and capture the image on that time. And but in the hospital, the robot can do much more than a simple infrared clinical exam. The robot system represents a mobile telepresence that can move between patient rooms, wards with a hospital setting. And he goes automatically as based on established map of the architecture of the hospital. So this is the first telepresence robot for post-surgery operative assistance based on infrared image or infrared driving. Telepresence is the concept that the clinicians can be present at the bedside. So the doctor could be talking with the patient in the spirit, if not in person, and is able to observe and respond in a lifelike fashion as if the clinician were in the room itself. We see this good connection also with children, elderlies, and they don't be afraid. They like that. They like to talk with the doctors. But it's not just as the same as an iPhone, cell phone, or a tablet, but much more than this, because we are talking that it's possible to put another sensor here and analyze many non-visible clinical aspects of the patients. So telepresence is facilitated through the use of a robot, which is remotely controlled via internet connection. The doctors can talk with the patient and also see the infrared image or the thermal image that comes from the patient, understand many of disease. The telepresence infrared imaging permits the clinician to walk from bed to bedside, not driving the equipment because it's not need. He just put, I want to see patient John with number 307. So he goes automatically in front of the bed and start the communication with the patient. Sure, the patient know before that he will have a post-operative with that, but not only with that. We keep our team, we keep our residents, we keep the surgeons on that, but we improve the assistant, giving more opportunities there for them to talk not only with surgeon, but with the physiotherapist, with nutritionist, with his family on this kind of communication, especially to collect data, infrared data, biological data of this patient. The remote site can be anywhere that is connected to internet technology and is well accepted with all of the team, the medical students, physician assistants, surgical residents, nurses, and all. The post-operative robotic teleround permits many things: a face-to-face service for clinical infrared diagnosis and screening. And the robot was driving to each patient bedside in just the same way as walking in the patient room. And also in intensive care units, our process incorporates the use of the robot within the workflow of providing daily care for critically ill patients in intensive care. We started in COVID and we are using to nowadays. There are many papers about that in literature, very interesting. For example, Vispa and et al. Showed that the use of robot teleround in ICU patient increased by 11% and lead to a saving of about $1.1 million in ICU costs for the period of 2005, 2006 in UCLA Medical Center. Nowadays, with new technology, new the sensors and the experience, we are reaching 3 million in intensive care units costs, saving 3 million on that. Susher et al. Reported surgical intensive care unit patients and their families would believe the robotic teleround, which can provide benefits for their care. People like families also. Garingo et al. Collaborators introduced the feasibility of teleround in neonatal intensive care with data analysis and patient round data, clinical outcomes, length of stay, hospital costs. So here is the infrared teleround. It goes automatic. There's no one driving. You can come with the doctor or with the nurse inside the room or with the resident. The equipment stop in front of the patient and talk with patient, ask for the patient to be prepared to be examined. In this case, is a post-operative evaluation, and so the machine automatically focus on the abdomen and start to move uh, make a move of the abdomen and collect information, clinical information. Okay, so this is an example of first post-operative day of a robotic laparoscopic gastric bypass operation. We have robotic surgery that are evaluating post-operative with robots too. It's full robot during and after the surgery. It's a very interesting concept, and we are in this being resulting in substantial cost saving for the hospitals and for the patients, because we can make many things. The goals of that are post-operative support anytime, anywhere, complementation of the medical visit, complementation, safe early discharge to be secure. So it's not mind if we didn't find nothing. It's good because it means that it's all secure. So the negative finds are much more important to us than the positive, to give safe early discharge of this patient. For example, instead the patient stay 3 days on the hospital, he could be stay only 2 days doing the last visit on the night, on the night of the second day, where the surgeon can review and talk with patient and give a discharge of him. So with experience and know how it works, it's possible, and we are doing this and saving costs hospital a lot, reducing 1 day of hospitalization. Much of the case, depends of the case, right? Higher bed turnover, so we can have more turnover doing that. Early identification of risks, risk of infection, risk of fever, risk of problems on the wounds, by visual, by infrared, by audio information, by interpretation of the face of patient, by comparing the recorded communication some days before and after, and you can evaluate the patient much better. Most of the time we see the patient and it's not so perfect to remember all the aspects. And when we record that with the robot, we can compare many other things that are not visible, that are not easy to identify normally. More humanized medicine, yes, more humanized, because you talk more, you explain more, you show the image for the patient if he has a problem, or you show the image of the abdomen that is normal if he don't have a problem, and that he can go back to home more early. Precision medicine with technological support, post-operative electronic documentation, all goes through the report of the patient, physiotherapy and operative nutritional support. So it's not only the surgeons or the residents, but also all the team can use this support. And also a great hospital integration of teams and different medical specialties to attend the patient needs. Interdisciplinary approach. So, we have some situations that we need to talk with another cardiologist that was not from the hospital, or that it was in another state, and it was we facilitate communication with patient based on the robot platform for help on that. Here's an example. Is the first day of post-operative surgery. You see the yellow. Yellow means a moderate metabolic grade of the abdomen. Here's on the third day. On the third days, we saw there's a worse situation. It becomes on the red. Red means a more intensity metabolic that could be inflammation or early infection. And on this case, we did many images with the robots, confirming and sending this to the surgeon. And this was analyzed by the AI, the algorithm, but also visually by the surgeon. And they started suspicion of a beginning of infection condition. And although the ultrasound, the abdominal tomography were still normal, was changing the conduct on this case. and they start showing a better support on hydration, and reviewed fast and started antibiotic therapy. And the patient did not develop further complications and was discharged on the 7th day. This case would likely progress to complication at home if he has discharged him on the 3rd day, as normally we did. And on this situation, we didn't discharge him, and he kept on the hospital, but he didn't have the complication during his hospitalization. Here's the infrared robot in standby, charging its battery at a nurse station. That we have a nurse station where he stayed there to charge battery, and he goes to the bathroom by himself when we put command to do that. And let's see the infrared scanner application. So we have many examples. I'll show some of that I think is most important. First, it's important to remember that infrared imaging is not only it's not experimental. It's FDA approved, and also it's a medical technology level 1 hospital, as determined by the World Health Organization. And let's see some example of assessment of abdominal complications. Here, an early identification of surgical site infection in patient that was with not fever, but a little higher temperature, and the robot registered the vital data with infrared imaging and started and confirmed after the infection. It's possible to perform abdominal fusion images. Here, another example of trauma surgery with where we didn't detect nothing on the first day. Here's on the 3rd day, normal elevation of circulation in the wounds, and here's on the 5th day. In this case, we had elevation of perfusion on the 5th day. See the 3rd, 5th day, sure, another case of infection suspicion. He was involving into abdominal wall descent, but early intervention plans enabled the surgical clean of the infection and health restoration, and he returned to home more early than to expect 1 week to have infection, more 1 or 2 weeks to treat that. So in 10 days, he was at home compared with the normal situation that is in 20-25 days. There are many applications on literature of infrared imaging, also, for example, to study the microbiota in Crohn's disease, so you can see complications, visceral complications by infrared imaging. Also, to measure vital data assessment, the most interesting is to identify or to measure the respiratory rate by the nasal temperature. So during inspiration, it's possible to measure this without touching, and sure, connecting this image with abdomen, with the fever, and other information, clinical information of patient. Here, example of fever. So normal image with fever, and this was confirmed 38.6 in the children. Is a children with fever, is a children normal. We measure the brain temperature. So doing the image of face is possible to identify suspicions, case of infection, pulmonary or any site. Here's how the infrared imaging doing that. So it measures the blood flow increase near here on the eyes, on supraorbital artery. And also it's possible to have idea of some psychophysiological approaches and study emotions of patients. So the combination of different perfusion areas on the face, you can have idea if the patient has stress. Stress diminish the perfusion of nose, maxillary region, and during pain, there's diminish the forehead flux and maxillary, and also the fingers and palm. During anxiety, it increases. So you can, during the interview with patient, the sensor can give by intelligence algorithm, artificial intelligence algorithm, how is the patient is more looking like more on that moment, stress or pain or fear, and it helps the decision what to do with the patient. It's also possible to measure the fatigue of these patients or non-restorative sleep by studying the face. So the image of the face becomes very different by the sensor. So the doctors don't need to interpret image. The algorithm and the AI give the response of what's happening with patient. It's Aillumi-based system. Aillumi is the name of this solution. For vascular evaluation, it's possible to identify ischemia, limb ischemia, or identify the level of amputation in some cases, like here. We know that here has circulation, here don't have, in diabetic foot. Here is a case of venous access using infrared imaging. The red area is automatically indicated by the artificial intelligence algorithm to save venous access. And also it's possible to study the cardiovascular risk doing this by distance. And it's very important, again, to emphasize the system, there's no risk. So no contact with patient, no risk of infection or infection between patients because there's no contact, no radiation, and no contrast. So there are many advantages to use this in a hospital as a rounding aspect. It's possible to be used in pediatric hospital and neonatal intensive care units, like in the children, also in the obstetric nursery for pregnant and parturient women. Here again is a paper published by Abbas showing the monitoring in neonatal intensive care. And for wound assessment, we can see the risk of the cubitus ulcer or pressure ulcers, especially intensive care patients, the neurologic patients, and the intensity of perfusion can be predict the risk of the ulceration in this area. So heat is a warning sign of the situation, and we can use treatments to prevent these or showing to the team, to the nurses, to the doctors that we need to do something to prevent ulcer of this kind of patient. So there are many papers of that, and our solution is now putting this all in a robot platform. It's also possible to do full body imaging or half body image like of these patients in intensive care to evaluate the risk of sepsis with a lung focus here on this case. Okay, so this in white means high risk. This is in red, it means less risk. So don't worry with the image. The algorithm do the interpretation of that. Okay, so it's possible to see pneumonia and also by infrared image together with X-ray. But if you want to do more and evaluate the evaluation of a pneumonia or infection, you see increase of perfusion on a specific region. And when you start antibiotic therapy, you can monitor this, seeing the decrease of perfusion on that area. Could be skin, could be pulmonary, could be brain, any part of the body, especially patients on intensive care. Here's an example of orthopedic example. There's a sternal fixation here, and the pins are free of infection. So it's a way, here we have infection, here no infection. Here's another wound, infected wound that started the treatment and antibiotics, and now it's normal. So before and after. And there are many advantages with this system. Summarizing, the intelligent infrared robotic service helps in telerounding for post-operative robot support because it involves telepresence and autonomous screening infrared driving. There are many equipments on this platform. We have the camera, we have the infrared scanner, we have the autonomous navigation, we have voice recognition, the hardware, the software, the program, speakers, and what else can the post-operative robot service do? So, incorporating this, the telepresence, we can have an immersive, autonomous online visit, allows doctors to visit their patients from anywhere, but not only doing this with the team locally. Allow families and members to visit their relatives from anywhere, especially in pandemic or infectious diseases. Autonomous navigation permits telepresence simplification, carry medicine, food, and objects automatically or guided by the robot. It's possible to bring there. Guide patients to a specific location within the hospital facility, and screening without exposure of hospital employees, protocol execution, data collection, reception, NPS survey, and all goes in a cloud platform, internet, simple platform, great interactions in the cloud, integrate with systems. So all the information goes to the patient report. He is social, able to speak your language, any language in English, Spanish, anyone, Germany, detect people and interact on his own with patient. And again, here's the sensors cloud example of the system. It's not expensive, it's affordable, it gives 24-hour support to the teams. It connects here the infrared, the robot. There's the brain, the Aillumi is the brain, is where he has an algorithm, and he connects the patients or the team and the data bank of that patient with what we're doing. Aillumi is the name of the artificial intelligence algorithm that describe what have in the image, so you don't need to interpret the image. Most of the time you understand, the patient understand, but the system can interpret the image for you. Thanks so much. Get in touch by my contact here, Dr. Marcos Brioski, and you can find in LinkedIn and contact me, or if you want to have opportunity now, you can do your question. Thanks so much, everyone.